Good morning. It's time to get in touch. In Touch is a public affairs show dedicated to improving the lives of Susquehanna Valley residents. I'm Freddi Hammer, News Director at Backyard Broadcasting. A new American Cancer Society report on colorectal cancer is showing that adults across the country are being diagnosed with colon and rectal cancers at younger ages, and that now 1 in 5 new cases are among those in people younger than 55, increasing about twice the rate from 11% in 1995 to 20% in 2019. The report also says that more people are surviving colorectal cancer, with the relative survival rate at least 5 years after diagnosis rising from 50% in the mid-1970s to 65% from 2012 through 2018, partly due to advancements in treatment. Regular cancer screenings and early detection are important factors in reducing colorectal cancer-related deaths. According to the American Cancer Society, when colon cancer is localized, that means before it's spread, the 5-year relative survival rate is 91%. When the cancer progresses and spreads outside the colon or rectum, survival rates are lower. Now, March is Colorectal Cancer Awareness Month, so now's the right time to talk about this very serious and life-threatening disease. But joining us today, happy to say, is Dr. Nancy Fitch. She's an emergency physician with MedExpress located in Wilkes-Barre, and she's going to share timely information about colorectal cancer, this study, definitely about the advancements in treatment. Good morning to you, Dr. Fitch. Thanks for joining us on In Touch.
Good morning. Thank you so much for having me.
Absolutely. I have lost a friend to colon cancer. I have one dealing with serious issues. I have one that's just dealing with a little bit of an issue right now. Everybody it's touching their lives, and I think the statistic of this is great. That means many people must be dealing with colon cancer and all of these things all at once here.
Very true. My father had colon cancer as well as several people in his family directly, so it definitely touches so many of us.
And I'm thinking about these advancements in treatment. Let's get to that throughout the show. But first, is it about a healthy lifestyle? Is it about if we ate fiber all of our lives, we may not have this issue? Or does it touch people in a different way than I'm thinking?
So there's a lot of different risk factors with colon cancer. So obviously, family history is probably one of the most important ones that we all know about.
Okay.
You know, if you've had a direct family member, you know, a parent, a child, a sibling who's had colon cancer, your risks exponentially go up.
Sure.
But inflammatory bowel disease and Crohn's patients have a higher incidence of it, and there's also a genetic syndrome that's a familial polyposis type syndrome that also can give you a very high risk factor for colon cancer. Other than that, you know, we always talk about this healthy lifestyle and how it has affected so many different things, but colon cancer is also one of those things that healthy lifestyle can benefit you to help keep your risk a little bit lower.
Okay. So that's about eating the right foods. We're talking about green foods and fibery foods and all that stuff.
Absolutely. You want, you know, a diet that's high in fruits and vegetables, whole grains, low fat. You want to decrease your alcohol and your smoking. As again, smoking causes just about everything under the sun.
Yes.
You know,
yes.
It's one of those things. That's probably one of the easiest things you could do to decrease your risk for everything.
Absolutely.
Not smoke.
You're talking about these symptoms that people may see. Is it just about the change in maybe our bowel movements? Is that what it is? And I know that's weird to talk about here, but it's so important. And it is Colorectal Cancer Awareness Month, so we sort of have to deal with talking about bowel movements.
You know, when you think about it, all those things that they're saying we should have, fruits, vegetables, high fiber, low fat, those are all things that keep your bowel movements regular. So those that have problems with constipation are probably not getting enough water, they're not getting enough fiber, and it's hard to get fiber. People don't realize if you're not a big vegetable eater, there's not a lot of fiber in our diet nowadays, and I think that's a big issue that's leading a lot to what's been going on with these increased rates.
Yeah, you can definitely see a trend, and you can probably make big assumptions about how it should change to make it a little bit different.
Absolutely. Absolutely.
And you look at one thing and you think, okay, I'm going to get wheat bread this time. But you look at it, there's only 2 grams of fiber in a serving, and there's only 1 gram of fiber in a regular piece of bread. So you think, is this really that big of a difference?
It's an issue. You know, Thomas's English muffins, we just went through this with my mom. She needs to have higher fiber in her diet as well. And the multigrain, 100-calorie, light Thomas's English muffin has like 6 grams of fiber in one muffin.
Wow.
Substitute with a regular Thomas's English muffin, 1 gram.
Oh, yeah.
It's a type of thing, especially when you have someone who has a diminished appetite to begin with. They need the biggest bang for their buck.
Absolutely.
And, one muffin for 6 grams versus one muffin for 1 gram, well, it makes sense to try and go for the biggest bang for your buck because she's not going to be able to eat 6 Thomas English muffins to get 6 grams of fiber.
Yeah, you have to make your choices, and definitely the labeling is something that we probably should take a look at. It's easy to read labels for people. Are they checking these things? And, there's all kinds of little formulas can do about fiber and what we should be eating. Hopefully we could just get better with it.
Yes, we should be getting about between 20 and 25 grams of fiber a day. And that's not easy to do, believe it or not.
Like, what's an apple?
Hard.
What's an apple fiber? Like, you eat one apple with the skin on. How many grams of fiber?
About 1 to 3 grams.
Oh my gosh, you'd think that you'd get like 6 or something. You need to get those sneaky fiber foods like tortillas and stuff. They're like 25 grams of fiber in here. So
avocado, surprisingly enough, has a pretty decent, an avocado is not a real big item,
right.
And one avocado can give you 8 grams, I believe it is, 6 to 8 grams.
Okay. Well, all right. Yeah. It's definitely a wake-up call for our appetites and our lifestyle. Maybe the family factors are how they've been cooked for all their lives and has something to do with it.
Absolutely. Absolutely. And there are some people that just don't like their vegetables, which is it's a problem. That's one of your main sources. And, fiber is also broken down into soluble fiber and insoluble fiber.
Okay.
So, the soluble fibers are the ones that you can dissolve in your drinks, and they're the ones that, are in the gummies. Those are soluble because they can be dissolved. Those can help keep your bowel movements a little bit more regular, but it's the insoluble fibers, which are the ones that you get from actually chewing them because they don't get broken down.
Okay.
Those can help keep the bowel movement a little bit bulkier, which helps retain more fluid in the bowel movement, which helps with limiting constipation. So
you can bulk it up a little bit with some supplements like that. That wouldn't hurt.
Correct. They do make like the Benefiber that dissolves in the water. They have the fiber gummies and all that. But, just using them to try and get your 20 grams is not going to be quite enough to keep the stool a little bulkier.
Yeah, definitely try salads. Even a salad a day, I think you'll notice.
Oh, yes, definitely. Sure. You would notice an improvement.
Now, we're talking about getting a screening done and lots of information about that. We had, celebrities touting the fact that you need to get your screening done. My husband survived because of the screening. Now, we're looking at different things. There's a way you can get a screening and send it in the mail. There's a couple different ways we can get screened. So give us some lowdown on what we should do.
So the gold standard has always been, the top of the line has been the colonoscopy. But prior to that, there are other means that can be used for detection. So, there's the fecal occult blood, and that is done with a little card, and it uses a chemical called guaiac, and it looks for a color change in the stool with the chemical. Then there's another one that is, they use a different, and it's done the same exact way, but it looks for antibodies. It uses a different type of immunochemical. Then you have the combination that looks for blood, but it also looks for altered DNA. That's the one you're seeing advertised on TV nowadays. It's called the Cologuard.
Okay.
So the Cologuard requires a much larger amount of stool to do that. So you have to actually send in a bowel movement, a whole bowel movement. It's kind of gross to talk about, but you got to send in the whole bowel movement.
I don't want that job of getting the mail. That's a bizarre thought.
It is. But, it's actually pretty good. And if that comes back positive, then you should move to the next level and have the colonoscopy done.
Okay.
It's meant for people who are at more of a low to average risk for colon cancer. Those that are at a high risk should probably not rely on that one as much and go right to the gold standard of colonoscopy. Again, a gastroenterologist would be the one who would discuss those with you as your options. The fecal occult blood can be done right in the office with a digital rectal exam. That's not something anyone wants to have done,
right. But why not find out if you're a person that may have a risk factor?
Absolutely. And men, once they hit that age of 50, should be getting an annual prostate exam anyway. So at the time of doing the prostate exam, I would imagine almost all urologists would automatically do it for fecal occult blood. Hey, if you're in there, get all the information you can get, right?
Absolutely. So when you talk about, they say, they found a polyp, but they're going to test it or whatever. So is that a serious situation when you find a polyp?
So most colon cancers do start off as precancerous polyps. So if you do have polyps, the experience that I've always had, and I'm not a gastroenterologist, but, the polyps, if they're found, your frequency of colonoscopies becomes more frequent.
Okay.
You have your colonoscopy done and it's clean as a whistle, you're good for the next 5 to 10 years, depending on your risk factors. And the gastroenterologist is going to determine your frequency of the colonoscopy based on your risk profile. So, they might say, okay, someone else who has no family history and has no other risk factors, we're going to do you every 10 years, but your family risk is high, so we might do you every 3 years. Once you find that polyp, the cadence for those colonoscopies might change. I know back when my dad had his first polyp, and we're talking back in the 80s, the cadence became a colonoscopy yearly until he was polyp-free for 3 years.
Wow.
Then he went to every 3 years.
Okay.
Again, that was his gastroenterologist cadence, and your gastroenterologist might be different. They're all going to,
For specific cases, of course.
Right. Because of his cadence, they did find his colon cancer when it was just local stage. He had surgery, removed it, and he had no other treatment necessary. No chemo, no radiation, wasn't in the lymph nodes. It didn't even break through the external portion of the colon.
That's great.
But the other screening methods, you can have a flexible sigmoidoscopy, which is similar to the colonoscopy, except they don't go up as far. They only go up through the sigmoid, which is the lower portion of the large colon towards the rectum. And the problem with that, in my dad's case, that would not have been enough. His colon cancer was actually found down in the ascending colon, right above where the appendix is. So had he just had flexible sigmoidoscopies, they never would have found his cancer.
Okay.
It was the colonoscopy that they found it.
Is that the advancement in treatment that we're talking about, sort of advanced things that go further, or just is that a choice to make as you take the test?
I think, again, it depends on your risk profile. There are going to be certain people who flexible sigmoidoscopy is a great screening, but when your risk profile becomes higher, then the colonoscopy is going to be the gold standard. But the treatment, I think, because we are screening more aggressively, and now that they've dropped the age, I think that's where the advancement is coming in with the treatment is the detection as well. I'm not that well versed on the treatment, as far as chemo, radiation, those kinds of things, because, again, my dad's was very local and surgery, and that was it.
I'm wondering about the polyps. Can you have a polyp and take those chemical tests that are just testing for blood or different things, and can that polyp not turn that test positive?
Very often it doesn't.
Okay.
The polyp has to be inflamed or irritated to be releasing any blood, and that's what it's looking for. It's looking for blood. When you have, a cancerous lesion, there's an erosion in the lining of the colon, so it leaks tiny amounts of microscopic blood. So you might not even see the blood. That's why these tests are so important. It doesn't have to be visible blood that's being detected. It's microscopic blood that you would not necessarily see.
So what are we thinking as a risk factor to this? Will we have any pain? Is it kind of something that's secret and silent, and then all of a sudden we have to deal with this? Is it different for everybody? How does that work?
It can be different for everybody. The earlier on in the disease, it can be very asymptomatic, which is why, you can still have cancer and not have any symptoms. As the disease progresses, your symptoms can become more pronounced. You can see actual visible blood in your stool. The stool consistency can become different. The typical thing that they talk about is ribbon-like stool. In other words, the stool becomes very thin, pencil-like, because that's a lesion that's really constricting the colon, and that's the only space that the stool has to go through. So the stool becomes very thin, like a pencil or ribbon, instead of, a little bit bigger caliber of stool.
Sure.
Then that becomes painful. You start getting some abdominal discomfort, changes in weight because you're going to stop eating as much because you're going to get full faster. Just kind of everything backs upstream.
Yeah.
Early on, though, the symptoms can be none.
So these screenings are super important, especially now that they've said that the ages is coming down. Studies say that people younger than 55 are coming up with colon problems.
Absolutely. Yeah, so that's why they dropped the screening age to 45.
Oh, I see.
Yeah, and they're finding, too, that the younger you are, it tends to be a more aggressive form of cancer.
We were talking about food earlier in this program, and definitely when children nowadays, pulling out something that's processed that doesn't have any fiber in it, sort of coming up as a trend itself.
What is our statistics for obesity in our country?
Sure.
That is one of the risk factors. The vast majority of Americans are overweight, if not morbidly obese, and that puts you at risk. I'm seeing more and more kids at the age of, I had a 5-year-old who was, tiny little 5-year-old height-wise, but weighed over 200 pounds.
Oh, my goodness.
So the risk factors go up. And again, the diet part of it, the overweight, you see the overweight part of it, the diet that falls into that also leads to increasing your risk.
Well, certainly awareness of like this. March is Colorectal Awareness Month. We need awareness as well on our diets and different kinds of nutrition aspects that go hand in hand with dealing with colorectal cancer, I'm thinking as well.
Yeah, absolutely.
So when we talk about getting the colonoscopy, we talked about that. Drinking the stuff, and it's painful way before. Then you get to go to breakfast and everything's fine. That's sort of the process that you go through, isn't it?
It is pretty much. The different prep, the last colonoscopy that I had, the prep was not bad. I didn't mind it at all.
That's good.
But the different preps that are out there, they change from year to year. But probably going through the prep is the one thing that people despise the most. But it's not horrible. It's a couple hours out of your life to maybe save your life. So it's one of those things where you have to kind of wrap your brain around that. Mm-hmm. And there's a lot of things that we do medically to keep ourselves healthy, but the actual test itself, you're under sedation, you don't feel anything, you're asleep, you wake up, you're done, you eat, you're out the door. So
yeah, you get to spend the day home with your family. Sounds right.
Absolutely.
One quick question on the side. Does diverticulitis have anything to do with, could this be any kind of a risk factor, or is that just a separate condition?
It's its own separate little condition, but also, fiber plays a big role in that. And, a lot of people that develop diverticulitis or diverticulosis is what starts that process. They're little tiny hernias in the bowel wall. Okay. So it's more a function of the bowel wall itself not being, as we get older, you can get these little pockets that form. They don't list anything that says that that's an increasing your risk of colon cancer.
I see. Dr. Nancy Fitch, she is an emergency physician with MedExpress in Wilkes-Barre, and I've spoken with you before. You're definitely a great resource for us and giving us information about March being Colorectal Cancer Awareness Month, and you've given me some information that I didn't know before. So thank you very much for joining us today on In Touch.
Hey, you are more than welcome. Happy to do it anytime.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us regarding questions, comments, or topic ideas, call weekdays between 8 and 5, 570-323-8200. You can also write to us at 1685 4 Mile Drive, Williamsport, PA 17701. Attention Freddi Hammer. Or email me at fhammer@backyardbroadcasting.com. For archived programs of our In Touch series, you can download and subscribe to our new Backyard Podcasting feature through a link on any Backyard Broadcasting website or obtained where podcasts are available. You can also subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch, a production of Backyard Broadcasting.